Well, good morning, everybody. Welcome to the JFK Partners Transition webinar series. And today we have two great speakers who are going to be talking with us about sexual development with adolescents with autism spectrum disorders. So our first speaker is Caitlin Middleton. And she has a PhD and is a Colorado State licensed psychologist and assistant professor in the Department of Pediatrics and Psychiatry in the section of Developmental Pediatrics at the University of Colorado School of Medicine. And Dr. Middleton's primary areas of clinical specialization include assessment and treatment of neurodevelopmental conditions, including autism, spectrum disorders, intellectual disability, and disruptive behaviors, including certification in the Parent-Child Interaction Therapy, or PCIT. She also specializes in evidence-based treatments for co-occurring mental health conditions in autism spectrum disorder. And then we also have Lindsay DeVries, PhD. She is an instructor in the Department of Pediatrics at the University of Colorado School of Medicine, and she's a practicing psychologist with developmental pediatrics at Children's Hospital Colorado. She received her BS in psychology from the University of Wyoming, and then she completed her MS at Eastern Kentucky University, where she completed an interdisciplinary certificate specializing in autism spectrum disorder. She then completed her PhD in counseling psychology at the University of North Dakota and had a 2-year postdoctoral fellowship at JFK Partners. Her research and clinical interests include the assessment and treatment of autism spectrum disorders and co-occurring mental health conditions, sexual and reproductive health in individuals with ASD, and the influences of having a child with an ASD on family well-being and functioning. So welcome to you both. We will be taking questions at the end, but you are also welcome to put any questions or comments in the chat box. And we'll be monitoring those as we go along. We are recording today's session and we'll post it on the JFK Partners website after the event. So take it away, Caitlin and Lindsay.
Thank you, Gina. So I'm going to go ahead and share my screen. And we can get started.
Wonderful. Thank you again, Dina, for that warm welcome. We're really excited to be here. Today, what we're hoping to talk about is we're going to be talking about sexuality as it applies to adolescents with autism spectrum disorders. And so we have a few objectives that we're hoping to achieve today. First, we want to talk about common misconceptions and myths around intimacy and sexual development in teens with autism, as well as exploring core components of relationships and sexuality for teens with autism, including gender identity, dating, social safety, and sex education. And then lastly, thinking about how to learn how to build these skills and strategies to promote sexual health development in teens with autism.
So first we'll start with a little chat. And if you could all, the first question we have for you, if you could just type in the chat, what do you think could be some challenges for adolescents with autism navigating sexuality and relationships?
I see sensory challenges, autonomy, reading nonverbal cues, being vulnerable, rigidity, social skills, boundaries, consent, communication, thinking about identity, generalization of skills. Yep. Lots of things about reading cues, dating, having less privacy. Absolutely.
I saw one about navigating identity and having maybe some confusion about identity, boundaries. Great. And so we're hearing a lot of things that we'll be touching on today during our presentation. So I'm glad to see that. The other question that we have for you is, what are some strengths that you think people with autism bring to relationships? And this could be any kind of relationship. Honesty.
Lots about honesty.
uh,
Yeah. Love, persistence,
mhm,
compassion,
mhm.
humor. Absolutely.
Rule follower. My husband is a rule follower and I am the opposite, so we complement each other very well.
Yeah.
Genuineness, great.
Empathy. Absolutely.
Mm-hmm.
Yeah, and I think part of the reason why we are doing this is, I think oftentimes when we have these talks or have participated in these conversations, it's so easy to focus on the things that are challenging for autistic folks when they're entering relationships or going through adolescence. And really, people on the spectrum have wonderful strengths that they bring to relationships as well. And so we want to acknowledge and honor that when we're thinking about how to best support folks and make it so that this journey is not unduly difficult or challenging.
And we want to also keep those strengths in mind as we talk through some of the strategies and the applications of some of the skills that we'll be talking about in thinking about a strengths-based approach to working on some of these skills. Well, great. Thank you for your participation.
So before we really dive into the content, we want to talk just briefly about autism spectrum disorder. And you'll likely hear Caitlin and I using different terms interchangeably, referring to autistic learners or autistic people, as well as people with autism. And we're doing that consciously in order to honor individuals and self-advocates that choose to use diagnosis first rather than person first language. There are different thoughts about this, but we want to make sure that we're being true to both. So briefly, when we'll be talking about core deficits or challenges that come along with autism, and we just wanted to review really what we mean by that. So when we think about autism spectrum disorder, we think about these two big buckets of social communication and restrictive and repetitive behaviors. And when we're talking about social communication, some of the big things that come up when we're thinking about sexuality and relationships are difficulties with social emotional reciprocity, that give and take that you might see in relationships, whether they're intimate or friendships, as well as communication. So thinking about perspective taking, nonverbal communication, the words we use and how we use them. The second piece, though, is restrictive and repetitive behaviors. And so some of the things that we'll be referring to when we use that terminology is thinking about sensory differences, having really strong interests, maybe having a difficult time with flexibility, or repetitive behaviors that sometimes can get in the way, or sometimes those things can be a strength as well. So it's important, like we said, we're going to talk a little bit about myths around sexuality and autism. And if people have heard additional myths, feel free to put them in the chat. But there's a lot of myths that we commonly hear about autism and sexuality. And I think some of the biggest ones are that folks on the spectrum aren't interested in relationships or don't have a sex drive, or that if they are engaging in relationships or a person is interested in a relationship with somebody on the spectrum, that it's somehow wrong or predatory. And that just simply isn't true. Additionally, we also hear this language that is really similar in other areas, like when we think about the suicide literature, that if we talk about sexuality, then it's going to somehow cause a person to engage in challenging sexual behaviors or cause problems when there wouldn't have been problems before. And really what we know from the literature is actually talking about this stuff opens the door and empowers folks that are on the autism spectrum to be able to make choices that fit well for them and what their needs and desires are. That being said, there are a lot of problems with how I think traditional sex ed is done now. And so for most people, when we think about formalized sexual education and reproductive health courses, they are taking place in public school systems. And part of the problem is that there's really variable access for autistic learners. So sometimes what I'll hear is that folks on the spectrum are being pulled out of those classes to make room for supportive services that they're receiving through their IEPs. So instead of going to sex ed, maybe they're going to speech or a social skills group or some of those other services. Sometimes that varies by cognitive ability. So rather than thinking about how can we make this curriculum accessible, it's just this assumption that I think that goes back into what those myths are, that the person, because they have an intellectual disability, doesn't need sex ed. And there's a lot of variation, whether we think between states, districts, or school as to what a curriculum really looks like when a child receives that curriculum and how it progresses throughout the course of their education. Maybe most importantly, most traditional sex ed curriculums really ignore those core deficits that we talked about. So when you maybe reflect back to the days that you received sex ed, if you were in a formalized sex ed program, there probably was little talk around things like consent or dating or thinking about how do you flirt or start a relationship or stop a relationship? And those are really important topics to folks on the spectrum. Additionally, it often ignores LGBTQ relationships and identities. And one of the things that Caitlin will be talking about more is that we know from research that autistic people are more likely to identify as LGBTQ. And there's actually been research that shows that compared to neurotypical adults, autistic adults are saying, we want more of this education and we want it earlier, especially around LGBTQ issues. So all of that said, this is kind of what the standard is when we're thinking about sex ed. And really what tends to happen is rather than having preventative programming, we end up having reactive programming for individuals with disabilities, specifically autism. And so oftentimes Caitlin and I won't see an individual or a family to talk about these things until a problem has already come up. And so we want to think about how to support people in a more proactive manner and making this curriculum more accessible.
And there's a little bit going on in the chat. Someone said that school personnel may not want to deal with these topics or may not want to deal with, I think, some of the complexities of this. And then someone is saying that sex ed was maybe too early for her son, and that he, the understanding of his body and understanding, the kind of the foundational pieces before doing sex ed weren't there. And then there's a question about advocating, and if we have suggestions about advocating, which we will definitely get into during this talk. So thank you for bringing these topics up.
Yeah, and we will definitely talk about that. And so when we're thinking about, well, do we know if there are gaps in knowledge about sex when we're thinking about folks that are neurotypical versus folks that are on the autism spectrum? Some research really indicates that, yeah, there is. And Caitlin, you can push the button and it should show an image. Yes. Yeah, sorry. There's research that shows that approximately 40% of people with autism don't receive any formal sex ed in school or in the community. And there tend to be some areas where they're getting more sex ed than others. So areas where they're getting comparable access are around things like hygiene or privacy. But some of those things are still, once again, being taught in a way that may not be the best fit or the best timing for what they need at that time. What we also know from research is that individuals with autism receive less of their knowledge about sex from social sources. So thinking about peers. And we know that as we move into adolescence, those peer relationships start to gain more and more importance. And so they're getting more information from non-social sources. And they're also reporting that they feel like they have less perceived and actual knowledge than neurotypical peers do. And another interesting thing from what we know about the research is that one of the big fears is that we want people to be safe and make good decisions and feel empowered when we're thinking about these things. And the risk of victimization by individuals with autism is somewhat mediated by how much knowledge they have about this stuff. And so it's really important that we think about how we fill in these gaps. And so where are people getting this information? There was a recent study done by a researcher at Tufts that looked at commonly reported sources of information with neurotypical adults and autistic adults. And most people are getting information from reputable websites. These are your .orgs, .edus, .gov. That's great. But also over 65% of respondents are getting information from websites of unknown quality, which is a little bit problematic. And then peers, parents, and providers. For folks on the spectrum, only 11% of them were reporting that they're getting information from providers, and 16% were saying that they're getting information from parents. And so peers, we already know they're using less social resources when it comes to getting this information. And we really want to think about, if the vast majority of folks are getting information from online resources and a good chunk from unknown websites of unknown quality, how do we fill in those gaps and make sure that it is a good place to get that information and that we're safe resources as well? So why don't we talk about sex? And it sounds like some of this was happening in the chat. I think that you guys were starting to hit it on the head. I think there's a lot of uncertainty about who should teach, what should be taught, when it should be taught, and how we should teach it. And I think there's also an issue and a barrier when we think about our own confidence in being able to teach this stuff. And really, am I doing the right thing by covering these topics? And am I able to walk that line as to what is too much, what is too little? And am I really teaching this material in a way that the learner is able to access? And so I think that the myths that we discussed earlier also serve as a barrier and kind of feed into that discomfort that many people are feeling and in thinking about this uncertainty.
And timing is really important too. We have to balance who should teach and what should we teach and how with timing, and when is the appropriate time, and that can be really tricky to know and to navigate. And I think there's different timings during school, in elementary or middle or high school, of when sex ed is taught. But then for kids with unique learning challenges or developmental disabilities, their learning trajectory may be a little bit different. And so thinking about their timing as well is important.
I think that there's also this idea that once you have the talk, it's done. And we know that for most autistic learners, it needs to be an ongoing conversation, and it needs to be something that isn't a one and done. And so that, I think, also feeds into what Caitlin is saying, that is challenging about finding the right timing, because how early and often do you talk about this stuff? So when we're thinking about general factors to consider, I think that it's really important to first and foremost think about values and intersecting identities when you're thinking about sex ed and reproductive health. And Caitlin's going to be talking a little bit about intersecting identities as well. But if we think about autism in and of itself as an identity, there are also things that also impact how you move through the world, and we all have them. So whether that's religious values and cultural differences, or language and race and ethnicity, or gender, all of those things need to be considered when we're thinking about how we teach and what it means for that individual. Second, I think that it's important to think about this stuff in the context of social communication and relationships, which we'll be talking about a little bit more in detail. And then you'll hear both of us talking about foundational skills and needs. Really, what is it that we're trying to get at before we can move on to these higher levels of things? And it can often be tricky when we're thinking about how we do this, because most people with autism their bodies are developing at a similar rate as their same age peers, but there may be other gaps and challenges that make it tricky to know where exactly those needs are. So perhaps they have a really strong interest in something that is more consistent with a child that's younger than them, or maybe their social maturity is more consistent with a person that's younger with them. But cognitively and developmentally, their bodies are in a much different place. And so it can be hard to find, I think, that sweet spot of how do you marry those two things together to find the right strategies to use and how we're going to be navigating these pieces. And then lastly, thinking about if there are issues that need to be undone or bigger issues first. And really what we mean by that is thinking about safety concerns or things that could really get in the way and provide a serious challenge. And so all of those are really helpful to think about when we're thinking about how to start to have these conversations about sex ed and reproductive health. So in thinking about this, there are local organizations that can help. I know that there was a conversation about, how do you really advocate for this at school? And when we talk a little bit about gender, we'll be talking about some school-based ideas as well. I think part of that is thinking about what does sex ed look like for your child or for the learner, and what kinds of modifications or things do you think that would be useful, knowing what you know about them? And so is it something that maybe it's too early for them, or maybe you feel like really they could use this even earlier, and thinking about how to incorporate that to their IEP or 504 plan if it's something that they already have in place. Additionally, if you're thinking about hygiene supports, thinking about things around privacy, taking care of changing bodies, occupational therapy can really be a great resource. Individual therapists too are a really great resource in thinking about how to work on some of these issues, especially if you've already maybe are seeing somebody that you have a great comfortable relationship with. That can be a person that's a good sounding board for some of this stuff as well. There are a few organizations here in the Denver metro area that tend to do more formalized sex ed for folks with developmental disabilities that we know about. Garden Autism Center has a program that they do for adolescents. Advocacy Denver also sometimes runs a group using the Elevatus curriculum. And I've seen several webinars and resources through the ARC of Colorado come through too, for parents and providers, as well as self-advocates around sex ed. And then in developmental pediatrics, we also have a group called the Birds and the Bees group, which is brand new, where we work directly with parents to talk about this stuff in more detail, about how to support kids through adolescence and moving into adulthood around sexuality and reproductive health.
And then also someone mentioned in the chat, Planned Parenthood, a 12-week program that their child did that was really beneficial. So please feel free if there are other resources that you know of. Lindsay and I are always interested in learning about new resources. So please feel free to share those. And we'll have more resources as we go throughout this talk, and then at the end as well. And hopefully you have access to all of these slides. So now we're going to talk a little bit more about sexual orientation and gender identity. And these topics are often talked about separately, but there's a lot of overlap. So we chose to include them together. We want to acknowledge and recognize some of the unique aspects of both, but when thinking about strategies and how to support, we really want to include both of these pieces. So first I want to show a video clip that a colleague recently shared with us, and I think it really exemplifies how complex these conversations have really gotten and some of the things to consider. Let's see. Hang on one second. Okay. Okay, there we go.
on just a minute there, Buster.
Dad, I'm supposed to pick up Emily in like 10 minutes. I gotta go.
Well, Emily can wait for a little bit, can't she? You got a minute to talk to your old man, don't you? Have a seat. You know, son, you're not a kid anymore.
Oh, no. I go to health class, Dad. I already know all this stuff.
Well, they don't teach you about everything in health class. Okay, Mr. Smarty Pants? So just listen. When boys and girls get a little older, they start getting interested in one another, right?
You know, and non-binary people, agendered, intergendered, FTX, gender fluid people.
What?
There's more than just boys and girls now, Dad. And they're not girls. They're women.
Yeah, okay. Okay, sure. Well, my point is that sex is, it's a very important decision.
How are you defining sex? Sex is different things to different people.
I guess when a penis goes into a vagina.
What if there's 2 men or 2 women or more?
More?
How would you define sex with multiple simultaneous partners? Or what if somebody's undergone genital reconstruction or is intersex?
No, but I'm just talking about normal, straight...
Normal. Come on, Dad.
Okay, here we go. Let me ask you this. Son, are you attracted to women?
Yes, but I'm young.
Is Emily a woman?
Biologically.
Okay, you're attracted to women. Emily's a woman. So if you were to have sex with Emily...
I wouldn't just have sex with Emily. We'd have to make that decision together. Homecoming's not an excuse to ignore consent.
I'm not saying to ignore consent. I never said ignore consent. You and Emily, right, consensually decide to have sex.
Vaginal?
Yes, vaginal.
Just 2 of us.
How many people do you want? Yes, just the 2 of you, Colin.
And I'm playing the traditional male role.
Go to homecoming.
You seem like you really wanted to talk about this.
No, I don't want to talk about anything. Ever again.
So I can go.
Please do. Out. Thank you. Don't forget your corsage.
Hey, Dad.
Yeah.
How do I look?
You look very handsome, son.
That's gender coding, but...
Get out of my house! Have fun.
All right. Let's see, I have to share my screen again. So that just gives you a little, I mean, it is from Comedy Central. So it is meant to be funny. But I really do think, you know, terminology does change so quickly. It can be difficult to keep up with what are the accurate terms to use when having these conversations. You know, how do we navigate these conversations, not only as a parent, but as teachers or providers or other family members? And I think, you know, one of the best things to do, which, you know, this dad didn't really do, is ask questions, you know, to be curious, to say, hey, you know, use self-disclosure. Hey, I don't really know if I'm using the right terms here. Please let me know if I'm not. So I do want to say something more about intersecting identities as we talk about sexual orientation and gender identity. And that is that all humans have many different identities that we walk around with, that we identify with. And this framework really does acknowledge that there are really unique challenges associated with having multiple stigmatized identities, that there are systems of oppression in place for many of these stigmatized identities, including disability status, sexual orientation, gender identity, race, culture, but these are not even all of the identities. This is just one graphic that I found that exemplifies it. And that people who hold multiple of these categories of identities, like being on the autism spectrum and identifying as LGBTQ, that they really experience a cumulative effect of discrimination or challenges or difficulties that are pretty different from the difficulties that come along if you only hold one of these identities. That there are really unique things to consider for someone who is autistic and also identifies as non-binary, for example, compared to a person who is autistic and heterosexual. And that there are additional stressors. And, you know, we've heard from kids and families, kids with autism who identify as LGBTQ, who try to seek resources or support in the LGBTQ community. And it's much more difficult, that sometimes the LGBTQ resources that we have may not be a good fit for someone with autism, but that's really all we have. And so having those additional intersecting identities does make it more complex. It's another layer that we have. And so I just want to keep that in mind as we talk about, it'll come up in a few other ways as we think about these things. So talking about sexual orientation first, this is really to define sexual orientation. This is really about who we're attracted to. This could be romantically, physically, emotionally. And recently there was this Washington Post article, a Gallup poll that came out. This was several weeks ago, maybe even a month or so ago at this point, that showed in this poll that 1 in 6 Gen Z adults identify as LGBTQ. And this is, up to this point, the largest percentage of a generation, the Gen Z generation, identifying or kind of openly identifying in a poll their LGBTQ status. And so I think this is a really interesting piece to consider, because in some recent research studies, there's also evidence, like what Lindsay said, that there are higher rates of autistic adults who are identifying as LGBTQ compared to neurotypicals. And we don't know exactly why we're seeing these higher rates. We can kind of hypothesize some reasons, but there does seem to be, unfortunately, some added stressors for autistic individuals who identify as LGBTQ. And I do think, so this can be mental health, anxiety, depression, suicidality, over and above what heterosexual autistic individuals are reporting. So I think this does go back to the intersecting identities piece, where there is this additional complicating layer of having autism and being LGBTQ. And I think we just need more research to understand, is this because folks who are autistic and LGBTQ don't feel as supported in the LGBTQ community, or they need more resources specific to their autism diagnosis? I think it's really hard to know, but we are seeing this pattern with greater stress and mental health. And I think also, as Lindsay mentioned, that individuals with autism are really not getting the kinds of access to sex education and relationship support compared to neurotypical peers. And I think this is especially true when you add in the layer of being LGBTQ and having sex education that is not heteronormative, that is supportive and inclusive to people who are LGBTQ. And so that places folks at a greater disadvantage in receiving their sex education. And then now to kind of hold side by side this gender piece, and that gender is different from sexuality or sexual orientation. And gender really refers to how you identify. And this could be, we live in a binary system, although this is changing slowly, but it is changing. And so gender is really if you identify as male or female or something different. And this can be very fluid. Sexuality and gender can be very fluid, but similarly to sexual orientation, research is showing us that people with autism do have higher rates of gender diversity or gender variance, or higher rates of identifying as non-binary. And so thinking about some of the challenges that you all were putting in the chat, a lot came up about being rigid or kind of overly focused. And that was one of the pieces of the autism diagnosis. And I think with these fluid topics or concepts of gender and sexual orientation, that it can be difficult for people with more black and white thinking styles when teens with autism are trying to go through the exploration of being a teenager and trying to understand your sexual identity and your gender identity, that it can be really hard because these concepts are not black and white, and they can be more fluid. And so that does make it harder. And again, we don't really understand why, or we don't understand yet why these rates are higher, but we know that it does add another additional layer of complexity. And I also just want to point out that exploring these parts of identity, that exploring your sexual orientation during adolescence, exploring your gender identity, even as young as, 2 and 3 and 4 and 5 years old, is very normal. It's a normal part of development. It's not indicative of a disorder or a problem. And so we want to think about how can we help teens and families and providers and school teams navigate this really sensitive time, and how do we help kids navigate their gender and their sexuality. So the next couple of slides are really based in the gender literature, but I really think there's a lot of overlap in how we think about supporting sexual orientation and sexuality exploration. So historically, there was this belief that gender non-conforming or cross-gender behaviors or sexual minorities, that should really be corrected, and that a child should be redirected to a more normative gender sexual orientation. And this has largely been debunked for many years, and that, really showing that interventions aimed at gender conformity or heteronormativity or sexual orientation, moving a child away from their expressed ideals is harmful, and that we should not be doing that, and should absolutely be avoided in treatment. And we see that, in fact, when kids are rejected or unsupported, that these outcomes are very poor. And this is not specific to kids with autism. This is kind of general, the literature on general outcomes for kids who identify as LGBTQ who are rejected or unsupported. So having increased depressive symptoms, self-harm, suicidality, increases in suicide attempts, even, PTSD, bullying in school, homelessness, incarceration. I mean, the outcomes are pretty negative when we use that type of unsupportive or rejecting approach. And so we really want to think about a more affirmative type of model, starting with the exploratory phase, where we are creating space to explore and express gender and sexual orientation. And this is the time to really be open-minded, following the teen's lead, supporting, asking questions, really trying to understand the teen's perspective and their interests and their desires, and really sending healthy messages about gender and sexual orientation. And this can start in childhood. This doesn't, you don't have to wait until a child is a teenager to do these things, but really starting this exploratory process early on. And we'll talk about some ways to do that. But then honestly, as time moves on, if a child is saying, or a teenager is saying, no, I have this persistent expression that I am the opposite sex, that the affirming or exploration stops being supportive, that it really stops being affirming when a child is saying, this is who I am. And at that point, we really want to think about, for people thinking about gender identity, that it may be time to transition. We don't want to send the message that a child is not capable of knowing who they are, or that they have to prove their gender identity before they can take those transitional steps. And so at this point, it may be important to start working with a specialist, especially if there are challenges or stress that comes along with the transition phases.
And I would just say that I think sometimes what we hear too is parents or providers saying, I don't know, maybe this is a restricted interest. Maybe they're not sure who they really are. And I think to Caitlin's point, when you're seeing that this is something that they're expressing pretty regularly, and you're seeing some of these other pieces fall into place, really the best recommendation for optimal outcomes is to believe them and to take it seriously.
That's a really good point, Lindsay. And then we also see in the research that the outcomes for kids who have this acceptance and support during their exploration and their transitioning, especially in adolescence, it's really
that we continue
it's
to talk about it, because it's not just New York, and it's something that's impacting a lot of other states and a lot of other Americans. We need to keep that top.
So we really see that the research shows that for kids who are more supported during adolescence, that there are better outcomes, that they feel more supported, they have more social support, they have better mental health outcomes, less depressive symptoms, just overall greater self-esteem. And so I like to kind of give these theoretical models behind some of the strategies that we'll talk about now, and thinking about, as we go into the nuts and bolts of how we support kids with autism as they're navigating their sexual orientation and gender identity, you have these kind of affirming and exploration types of models in your minds. So how do we support? Now we'll kind of get into some nuts and bolts. And the first piece is really about language, and how important language is, and it plays a big role in the message that we send to kids. So thinking about, even as kids are, really young, as, toddlers and 4 or 5-year-olds, that we can talk about gender roles and sexuality in less absolute terms. So saying things like some girls wear dresses, or some boys like to play sports. And then in terms of sexuality, some men marry other men, or some women marry men, and using less absolute terms to send the message that there are differences, that it is not a one size fits all. And then when kids are kind of getting to that point in adolescence, or even, before that, where they're expressing romantic interest or having crushes, using questions that are a little less absolute as well. So saying things like, is there anyone you like at school? Instead of saying, do you have a boyfriend or a girlfriend? And again, it sends the message, the language that you're using sends the message that you're open to these differences. And then, also from a young age, the language that we use to talk about LGBTQ people with respect, modeling acceptance, that how your acceptance and perspective about people in the LGBTQ community really matters as kids are developing. And then again, trying really not to assume that a kid's gender or sexual orientation, and that you're really following a kid's lead as they're going through their development. And these are some ways for providers or family members, therapists, teachers, that can do work on, you can do work on your own to really identify, hey, what are the areas of discomfort I have with this topic? Things are changing a lot all the time. And maybe there's a specific area, maybe sexual orientation feels more comfortable, but the gender identity piece feels more uncomfortable. And so reading up or identifying gaps in knowledge for yourself to be able to have these conversations. And then again, thinking about asking questions, being really curious and trying to understand where kids are coming from, and identifying like, hey, I don't know, I don't, like the dad in the video, kind of presented like he knew what was going on, or he knew he was really up to date on things, when in fact he wasn't. And so I think presenting that curiosity can be really important, and asking questions. And then something as simple as just having resources out in your office or your waiting room can say a lot. It can send a lot of messages like, this is a safe place. This person who, who I'm going to talk to in school, or that my therapist really knows about these topics, or at least is aware, to have these materials out and is more inclusive. So it feels like a safer space, or more comfortable to be, for kids to go and talk to you about that. And then school is a big piece. Kids spend a lot of time in school, and especially thinking about high schools, which is a really common time for kids to be exploring sexual orientation and gender identity. I think these are a little bit more specific to gender, but you can see some of the overlap with sexual orientation. But in thinking about gender and transitioning, how do you work with a child's school team for appropriate accommodations? And this could be things like including supports on an IEP or a 504 plan, things like what restroom will they use? What will sports or gym class look like? What pronouns are peers and teachers and folks going to use? Who are they going to tell? Who will they, other parents in the school? How will you navigate that? Dress code, there are a lot of things to consider and to potentially include in an IEP or 504. And then identifying a champion or an advocate or someone at school. This could be a school psychologist or a teacher, someone who has a passion or an interest in some of this work and could be a champion for the child. And then if there are LGBTQ or the gay straight, a lot of high schools have gay straight alliance groups to really support those groups. If a school doesn't have that, thinking about a way to maybe start one of those groups as a way to build community for the child. And so, I mean, there are so many ideas that we can think about in supporting kids in school, but these are just kind of the broad pieces. And then really thinking about when does this rise to the point of getting help from a professional? And we've talked about a lot of the challenges and those intersecting identities and the additional stressors of having autism and identifying as LGBTQ. And so sometimes these transitions and exploration go really smoothly, and other times they don't. And so if you're seeing really significant behavioral changes, so things like could be increased withdrawal, or it could be increased acting out. If you have concerns about mental health or safety, or if there are things that are interfering in daily life, like refusing to go to school or skipping class or self-harming behaviors, that those definitely all rise to the point of, okay, now we need some professional help. And then sometimes parents really just need support in navigating adolescence. It's a tumultuous time in general, and to add these additional pieces that are pretty complex, parents may need support in the navigation piece. So that, is always okay to seek help in those instances. So now we are going to shift gears a little bit, kind of keeping the sexual orientation and gender identity pieces in our minds as we think about dating. And first, I want you to type in the chat, thinking about what are the foundational skills that are needed to date for anyone.
Good social skills, perspective taking, boundaries, conversational skills, boundaries, being able to communicate if something isn't comfortable, coping, communication, respect, consent, starting relationships, sharing joy with someone, having varied interests, executive functioning to plan, flexibility. Oh, knowing the social norms for dating.
These are great. And we're going to touch on a lot of these as we talk about dating.
Self-assuring
consent. Yep.
And I just want to say, I think we've kind of primed you guys a little bit because we've been talking about autism all day. And a lot of these are kind of thinking about relationships through an autism lens, which is great. But there have been other times where Caitlin and I have maybe asked this question towards the beginning of a presentation. And one of the things that we see often is that there are really high ideals, I think, that people have in their mind in terms of what is a foundational skill to be able to date. And the fact of the matter, and the reason why we do this, is that everybody makes mistakes while dating, and there will be lots of missteps and errors. And sometimes our friends that are on the spectrum are held to a much higher standard than somebody that isn't on the spectrum. And we want to make sure that we're really acknowledging that and thinking about that when we're thinking about strategies to support.
Great segue. So dating is a natural progression of learning in adolescence, and all teens go through this, and it's always bumpy. I think I can use the always there. Like, what teen doesn't make a mistake when trying to learn how to flirt or ask someone out or, go on a first date? But determining when someone is ready to date, I think is really tricky. But you can think about, what skills does the person have, including their interest. I think interest really needs to drive some of this, because just because you're a 15-year-old or a 16-year-old doesn't mean that you necessarily have an interest in starting to date or being romantically involved with someone. And we also definitely, you were putting a lot of things in the chat. Advocacy is very important, and ability to communicate and stand up for yourself. Daily living skills are also really important, and being responsible and independent with some of the, the things that teenagers need to do to be more independent. But we also need to think about family and cultural norms as well, because all families have different rules or different expectations around dating and when it's appropriate to do that. And so it's not just the individual saying, hey, I'm really interested in doing this. The family that they're, living under their roof really, or their family's culture really can say a lot about what a child is able to do. And so we definitely have to include families in these conversations. And then we're going to get into safety skills. That came up in the chat a lot as well. Safety is very important, and there's a few different things that go into safety, and Lindsay's going to talk about that more specifically. But then really thinking about this idea of social missteps versus serious errors, that the idea of a social misstep is not unique to a person with autism or a teen with autism, that it is really, we all make social missteps, especially when we're learning how to date. It is incredibly awkward. It's not something that necessarily would come naturally to someone to, flirt or ask someone out on a date, that there's a learning process, and it's iterative. You kind of try it out and you see how it goes. You learn from your mistakes, and then you go back to the drawing board and say, hey, what can I do differently? And yes, maybe people on the spectrum really need help with that process. Some people do, in kind of thinking about what are the steps, and, perspective taking, that came up a lot, and really trying to understand missteps or learn from mistakes. But that's really different from serious errors. And the serious errors are things that can really get a person in trouble. And we want to do preventative teaching. We don't necessarily want to do reactive teaching, like what Lindsay has talked about with sex education. That we want to watch out for things like knowing if someone is saying no and not giving consent, or knowing when to kind of give up and not persist around asking someone out, or things like that. Those are more serious errors that we can do a lot of teaching around. And so then we have this question of really what do we teach? What do we focus on? We first, before we can know what to teach, we really have to take an inventory of skills that a kid has. And this can really vary child by child. And every kid has unique strengths and challenges. We talked a lot about, you put a lot of things in the chat in terms of strengths that kids with autism bring to relationships. And so we really have to take stock and understand, where are they with some of these skills? And thinking about daily living and hygiene is very important when thinking about getting ready to date. where those skills are. You know, dating is not a given for every child. It really is a choice, and it's a big responsibility. I remember being a teenager and wanting to date, and my mom saying, you know, you don't just get to do this. Like, you have to show that you are responsible in these other ways before you get to go on a date. And so the other big one is communication skills, and you know, knowing not just the nuts and bolts of how to have a conversation, but communication around advocacy. What, you know, if you're on a date and it's too loud, how do you say, I really need to get out of this loud place, it's really bothering me? Or, you know, if you're on a date and you're feeling unsafe and saying, you know, I really have to go, I'm uncomfortable, got to get out of here. That those are all parts of communication, and knowing kind of how to interpret those cues and really advocate for yourself. And then there are these nuts and bolts of dating that we have to take stock in terms of kids understanding. So, like, where do people go to even find a date these days? And then what happens on a date? Like the activities, I saw someone earlier put in the chat, like how to plan a date, how to plan an activity, and choosing. First, we have to choose an appropriate person to date. And there are certainly bad choices in dating. We don't get to date everyone. Everyone doesn't get to date us. So we get to make choices here. And so how do you go about making those choices? And then, of course, you know, how to stay safe and handle rejection, or be the one to reject another person. How do you navigate that? And I think one of the best teaching strategies for these topics for teens on the spectrum is really being very concrete and breaking concepts down into smaller concepts. That the concept of dating is a really big thing, but if we break it down into these smaller, more manageable pieces, it can be more digestible. And then talking about rules in these different areas, talking about real world scenarios, maybe bringing in experiences that kids have had themselves. And also video modeling can be really helpful. So thinking about the video modeling piece, I have two examples from the Peers program, and this is included online for free, and we'll give you that resource. That there are lots of videos on here that show examples not only of dating but of social interactions and social skills that you can use when working with kids. But I wanted to show you, I'll show the bad example first and followed by the good example.
While Caitlin is pulling that up, I'll just add that Peers is actually coming out with a curriculum specific for dating, hopefully within the next year or so. So keep your eyes out for that if there are people that you know that would really be interested in getting that type of support.
Okay. Can you see my screen?
Yes.
Hey, Lena.
Hey,
How are you?
I'm good. How are you?
Pretty good. We said 7, right? I got the time right?
Oh, yeah.
Cool. All right. Well, should I come in or do you want to go?
Oh, we could just go.
Okay.
And you can see, going back to the communication piece, that there really are, I mean, there are quite a few pieces here, perspective taking for sure. But I think this is a really nice example where you can show a teen and say, what do you notice? What do you notice that they're doing? What might he be thinking when she doesn't answer or when she doesn't offer more information, and really having a dialogue about that. Can you still see my screen if I go to the good example, Lindsay?
Mm-hmm.
You can, okay.
Hey, Gabe. How are you?
Good. How are you?
Good. Come on in.
Thanks.
So I don't think you've met my roommate before.
No, I
but
haven't.
That's Jordan. Jordan,
Hey.
This is Gabe. And I don't think you've been to my house, so
No,
let
I
me give you a
haven't.
little tour. So the living room's right over here, and the kitchen's that way. Do
Nice.
you want anything to eat or drink?
Oh, no, thanks.
Okay, cool. Well, I don't remember what time our reservations were, but do you want to hang out for a bit or get going?
Maybe we should just get going.
Okay, yeah, that sounds great.
Awesome.
Okay,
After you.
thank you.
And again, you can kind of see, this isn't a perfect example, but it's better in terms of offering information and sharing and trying to understand the other person's perspective coming over for the first time. And so you can then show a good example and have a conversation. What did they do differently? What did you notice? What questions did she ask? How was she engaging in conversation? And you can do more of that kind of iterative process. Okay. And then I just want to say just one word about dating in the time of COVID, and that it is a really strange time, I think, for teenagers to be navigating this process. I think it's probably, a lot of kids or teens are doing some online stuff where they're having Google Hangouts or Zooms or FaceTime, social media.
Hey, Caitlin, I can't see the slides.
You can't see the slides? Can you see
There we
them
go.
now?
Yep, perfect.
That was weird. Sorry about that. So thinking about safe dating in the time of COVID, I think a really good idea is to start with online and meeting someone for a few times online, and before meeting in person. And you can do things like have a Netflix watching party. And this is not specific to dating. I think you can think about how to do this with friends as well, to increase social interaction during the time of COVID. And then, if a person is ready to meet for an in-person date, thinking about and planning with the person, how do you stay safe during that in-person date, making sure that it's in a public place where there can be social distancing, maybe thinking about getting a COVID test prior to meeting, making sure that neither person has symptoms, deciding together about wearing face coverings, things like that. But it definitely is a trickier time to be navigating this dating piece. And so, of course, thinking about when and where to seek help if needed. Individual therapy, Lindsay has mentioned a number of these resources, but we wanted to include them. Individual therapy can be a really great place to work on these skills. There are peers groups and peers programs throughout Denver. The Garden Autism Center has programming for kids. And then social skills groups may not address dating directly, but could be a good place to start the foundational skills building for going on a date.
So now we're going to talk about social safety briefly, and then we'll leave some room for questions towards the end. And there's really a lot that's covered under social safety. So we're going to touch on several areas just briefly to give you a little taste of some strategies and some things that are important to consider. So when we talk about social safety, some of the common concerns that come up for us when we're working with teens and their families are around online safety, self-advocacy and abuse prevention, consent, stalking, and other challenging sexual behaviors. And so, like I said, we'll talk about several of these in a little bit of detail. Right now, I would say the primary one that I hear a lot of is online safety, because we're online a lot, especially this past year. And so there's been recent research that has looked at parent concerns and parents' thoughts on their own ability to keep their children safe when we're thinking about online safety. And the most common concerns around online safety, I don't think will be too surprising to you. Cyberbullying, thinking about accessing illicit content, scams or hacking, buying things without permission, and then also the risk for sexual exploitation or grooming to take place. And research really suggests that children that have autism experience more more safety risks online than their neurotypical peers. And parents of kids with autism report that they don't feel as well equipped as parents of neurotypical children to monitor their child's online safety. Really what it boils down to when we're thinking about safety is thinking about teaching skills, restricting access, and monitoring. And all three of these pieces are really important. It's not just enough to put up a firewall and say that you're done and call it a day. It's not just enough to teach skills and then say that that's fine too. You really need to have all three pieces. And I think part of the challenge that often comes up is that kids are much more tech savvy oftentimes than their parents. And I hear this scenario described over and over again, where it's like playing whack-a-mole, where you'll put up one firewall or block one device, and then the next thing you know, they found a workaround. And so really having all three of these pieces present is important when we're thinking about what is advised to keep people safe online. So when we're thinking about skills to teach, one of the big ones when we're thinking about rules is really this general sweeping statement that nothing is private on the internet. Even if we're thinking about sending a DM or a private message to a person, how private is that really? And I think you can make arguments as to some things being more private than others, but thinking about what is the safety risk of the websites you're using and how you're using them. And then also thinking about how honest should you be online. If somebody asks you where you're from when you're starting to get to know somebody online, do you give them your full address? Do you tell them what school you go to? Or can you just say generally the United States or the state of Colorado? And then I think a lot of this kind of comes down, if we're thinking about these foundational skills, about how do you discern what is credible versus what is problematic or a scam. And more schools are doing this when you're thinking about trying to generalize these skills, when they're thinking about researching and academic skills. So that's a really nice segue and a way to incorporate that into a broader topic of safety and apply some of those same strategies and working with your child's team or the team or if you're on the team at school, thinking about their parents in ways to do that. Another piece that's important is thinking about appropriate online etiquette. And I think everybody has misses when they think about how they communicate online, because there's a lot of context that's often not available or as readily apparent as there might be in person or over the phone. And so thinking about what kinds of etiquette is appropriate, and once again, balancing that with the honesty piece is really important as well. And you can practice that or work with a therapist to practice those skills too. And then lastly, and this kind of comes down to relationships, I think, is thinking about what is realistic online. So do we think that this is a really great online depiction or media depiction of how a relationship goes? Or do we think that pornography is really, depicting what intimacy looks like for most people? Probably not. And so sometimes having those conversations, if those are areas that your child is already involved in or areas of concern, can be really helpful too. When we think about monitoring and restricting, one of my biggest pieces of advice is to think about all devices. So I don't know if people have seen this tweet before, but it says, I don't know if this is going to tweet. I'm talking to my fridge. What the heck? My mom confiscated all my electronics again. And if you look, this tweet is coming from the LG smart refrigerator. And so this kind of gets back to what I said about kids just outfoxing their parents and knowing different ways that they can access things that maybe you might not be aware of. So instead of thinking about just the obvious things like thinking about phone and laptop and computer, also think about gaming devices, think about smart devices like Alexas or Google Homes, or if you have a smart fridge, think about that as well, and what kinds of protections need to be put in place or how to monitor them. And then there are, of course, firewalls and apps and things that can help you with that process. Many cell phone providers have different apps that can come along with a package for a child's phone that are free or low cost. And then also establishing some rules around internet usage. So for some families, it makes sense, and for some kids and teens, to have internet access restricted to public areas like the living room, or you can only have your internet access on between these certain hours. And there are different controls and apps and things like that that can help you with that process and enforcing that, as well as visiting where your child is going when they're online. And we've talked a lot around self-advocacy, but that also applies to safety. And so when I think about foundational skills, when we're thinking about self-advocacy, I think it's really important to think about some of the things that you guys have already talked about in terms of barriers or challenges. So if you have a child that's highly anxious, it might be especially hard for them to advocate for themselves in a tricky social situation. Or if communication is really challenging for them, thinking about alternatives that can be provided and how to help build those skills in areas that might seem to be safer or lower fruit than thinking about some of these things that can potentially be really risky and dangerous. Around social understanding, once again, kind of thinking about the logistics, like who is appropriate to ask for help? How do you ask for help? When do you ask for help? That can be really useful too when we're thinking about teaching self-advocacy and who those people are that are in their circle. And I think about all of this as a precursor to understanding consent too. So this self-advocacy piece is definitely important and something that we would encourage people to think about in all facets of their child's life. Other ways to kind of practice this is teaching that explicitly, but then also reinforcing when you see that happening appropriately and providing space to try it first, especially if it's a situation where you feel like it's relatively safe. And there's lots of opportunities in the real world to practice this, like ordering food at a restaurant or requesting help from school or really attending IEP meetings or advocating with helping professionals like their therapist or their medical providers. And then there's lots of opportunities in books or movies where you can see characters advocating for themselves. We have a shot here of Jasmine from Aladdin talking back to her dad about how she doesn't want to be a prize to be won. And you can have a conversation with a kid pretty early on about, hey, they stood up for themselves. What do you think went well? What do you think could have gone better? Or do you think they handled that right? How are the people feeling in that situation? As a way to open the door to those conversations, and then have role plays to kind of reinforce and practice those skills. So when I think about consent and decision-making, I think that it's also important to think about what makes a healthy relationship and how do you recognize signs of unhealthy relationships. And so I think that you can say with a broad sweeping statement, that relationship isn't healthy, but what about it isn't healthy exactly? And so sometimes it can be really hard to kind of pick apart those pieces, but it's important to think about what is abuse and who can abuse. So thinking about not just physical abuse, but also emotional abuse, financial abuse, sexual abuse, coercion, and other tactics that can be abusive. And I think it can also be challenging to think about the piece of who can abuse. Oftentimes, I think that there's this unwritten narrative in our society that abusers are strangers on the street and people we don't know. But oftentimes, and what we know from research is that abusers tend to be, more often than not, a person that a child knows in their life. And so thinking about that piece and how to educate around that and advocacy when it comes to safety and abuse prevention is really important. And then once again, kind of defining who would be a sounding board for relationships, particularly if you have a child that struggles with peer relationships and may not have a person in their life that you feel like is a good peer sounding board, or somebody that they feel really safe and comfortable with having these talks. And then you yourself as either a provider or a parent, thinking about how do you walk that line between, once again, like Caitlin said, allowing them to make mistakes and knowing when to intervene where it might be crossing the line into more of that serious error territory. So in terms of consent, there was actually legislation passed in the state of Colorado in 2019 that mandates that consent be covered in sex ed in public schools, which is excellent. But oftentimes consent is a really tricky topic to cover because consent is not stagnant and it can change, and it's really gray and difficult to tackle and know all the time. And so I think oftentimes people struggle with this idea of, is the consent really informed? And part of making sure that it's informed consent is providing robust sex ed, but also thinking about legally who can and can't consent. And so RAINN actually has a website that has laws by the states that's provided. So you can go and look here if you're interested in thinking about that. In the state of Colorado, a developmental disability does not act as a barrier for a person's ability to consent. If you have a developmental disability, you can legally consent. There are certainly age restrictions and things like that, but that's an important piece that I think not all people know about. And so I think that it's important to think about what the gaps are and how to explain the gray areas in this. And this is a visual on this slide that I saw on a YouTube video that I believe was done by a self-advocate, where they talk about how you really want to stay close to the green and the red where the 10s are, and the stuff in the middle, that's no good because that's where the misunderstanding happens. So that's a nice way to kind of make it into a visual. My personal favorite book around this topic for kids is Consent for Kids, and we'll have this in the slides as well. And it does a really good job kind of talking about some of the tricky pieces, like if a person is saying yes, but maybe their body's showing you no, how do you handle that? And if a person says no, but you're really hoping it's a yes, how do you handle that too? And that kind of goes back to a foundational skill of flexibility. And so if you're thinking about a kid in mind and thinking about how to teach this stuff, those are the pieces that can be really helpful to consider. So other common social safety challenges that come up and are misreading these potentially socially dangerous situations, thinking about stalking and harassment, and challenging and sexual behaviors. And you'll see that there is an image of a bouquet here. And a few people from JFK might know this story, but when I was a postdoc there, I got this bouquet of beautiful flowers on a random work day, and a card that just said, "I'm thinking of you always," and always was underlined. And my first thought was, who sent these flowers? Always is underlined. What does that mean? And it ended up being my husband, and we had a good laugh about it. But the context of that is a little bit different than if it was, you know, my anniversary, or he called me and said, "Hey, did you get the flowers?" And so sometimes what happens is that there are these behaviors that are perceived, I think, by our folks that are on the spectrum, that they're stalking or harassing or entering into these dangerous or potentially sticky social situations, when really I don't think that that's necessarily what happens. I think it's a miss, kind of like with this situation, of reading those social cues and knowing what is appropriate in that situation. And so I think it really boils down to the challenges in reading the social cues, also that ability to kind of focus on strongly preferred things, and then also this piece of lack of reinforcement for other strategies. So there's research that shows that folks on the spectrum might be, are more likely to persist pursuing a relationship after they don't receive a response, or they receive a negative response than somebody that's neurotypical. And so we need to think about how to reinforce more preferable strategies, or fill in some of those gaps in social misunderstanding, so that there isn't this perception that they may be stalking another person or engaging in harmful behavior. So when I think about strategies to be helpful, I think about teaching those clear rules that, you know, if a person doesn't respond after you text them twice, then maybe let it go. Or it's not appropriate to text somebody you like at 3 a.m. on a Tuesday, and things like that, that can really help to establish some boundaries that aren't very clear. And then also thinking about what is the goal that you're working towards and what is your path to getting there? And then thinking once again about those foundational skills and building up to that goal and that piece. So the last thing I'll say is one of the most common challenging sexual behaviors I hear about is masturbation. And so I'm just going to speak very briefly on this topic, but there's lots of challenging sexual behaviors that come up for folks on the spectrum around inappropriate touch, safety issues, coercion, stuff like that, and being victimized as well. And so I certainly don't want this safety part to send the message that we think that people with autism can't be safe or are perpetrators, because we know that that's not the case. But we also want to be thinking about these things that are kind of, common offenders when you come into a doctor's office or seek professional help, that are useful to think about in terms of a preventative lens and how to support folks when they're needing help with growing and developing. And so the most common concerns that I hear around masturbation are around excessive masturbation, public masturbation, masturbating inappropriately, like using objects or toys or things like that, or becoming upset when they masturbate. Generally speaking, masturbation is only considered excessive if a person is hurting themselves or it's interfering with their daily activities, where they can't go to school or their job or do other things because it's taking up that much time in the day. And so when I think about recommendations, one thing that I will say that isn't on this list is sometimes it's worth talking to a medical provider, because sometimes there can be medical issues that haven't been ruled out when there are masturbation concerns, especially if the individual has a difficult time with verbal communication or detecting things that may be going on in their body. And so always think about a medical perspective first. But a big piece is also thinking about the foundational skill of public versus private. And this can be tricky. You can talk about bathrooms as private places, but does that mean all bathrooms are private places? And does the person know that the bathroom at school is different than the bathroom at their house? And there's this little visual here in the corner. And if you've been to a talk that Caitlin and I have done before, you've probably seen this. And it's a very low-tech way to kind of reinforce this idea of public and private, where you can take stickers or visuals and put a red check mark or a green check mark to indicate if it's an area where you cannot masturbate or one that's okay. So thinking about the door frame to a bedroom or a door frame to a bathroom for stickers like this, or as a slight subtle visual cue for a person, can be really helpful. And then also it's important to think about providing that privacy and that space for a person, and then making sure that people have the same terminology that they use within the inner circle. So, thinking about recognizing feelings that they want to engage in masturbation and how to excuse themselves appropriately, and talk about how to do that within this social context that Caitlin and I have been discussing today. And then lastly, I would say, thinking about what need is being met by masturbation, especially if you feel like it's problematic. And so that's a place where a therapist can step in to help in thinking about how to shape that behavior or how to provide some space. And so if a person has a very unstructured day and there isn't reinforcement for much else, then thinking about how can you build in more activities and desirable things so that not as much of their day is being spent engaging in masturbation. And so there's lots of different ways that you can address some of these challenging behaviors when it comes to this piece. And so we just have a few resources that we want to share with you guys, and you'll be able to see these on the slides. I want to kind of bring attention to a few of them. There's some books that are great specifically around consent. My favorites for professionals in terms of supporting folks around this stuff is the Davida Hartman Sexuality and Relationship Education. And then I also really like Girls Growing Up on the Autism Spectrum. There's lots of books that are out there right now that start to kind of get at this stuff that can be really useful if you work with a lot of individuals that have these concerns or parents that have these concerns.
And these are for the next two slides. There are some books on gender identity. The Gender Quest workbook is really nice, and I have seen it used with kids with autism as a pretty concrete way to explore these ideas around gender. And then more on sexual orientation, books on sexual orientation that are excellent. And you can see some are coming out and are specific to people on the spectrum, which is really great. And then some websites and additional, we have a lot of resources, but we definitely want to get to, we probably have a few minutes, 5 minutes, if you all have questions. And I can actually stop sharing so we can see the full screen.
So one that I'm seeing in the chat right now is trying to understand a 16-year-old deciding he wants to be a girl, even though he truly likes typical girls and wants to date typical girls. Can you speak a little bit to that, Caitlin?
Yeah, I mean, I think this comes up, maybe I'm making a wrong assumption here, but I'm thinking that this 16-year-old is on the spectrum. And sometimes it can be confusing in terms of that black and white thinking piece where, you know, if I like a girl, I must be a girl, and confusing the gender and the sexual orientation piece. And I think really explaining the difference between gender and sexual orientation and what that is. Some kids really think it's the same thing. And so really talking about gender as your identity, if you want to be a girl, or if you feel like you're a girl, what does that look like? Are you wanting to wear certain clothes? Do you want to have your hair a certain way? Do you want to use she, her pronouns? Really getting concrete about those questions, and then saying, you are telling me you like girls, that you're attracted to girls. That means that you might have butterflies in your stomach, or you might think a girl is pretty, or you might be attracted or want to kiss a girl. And that's different than saying that you identify as a girl.
Yeah, I was just going to add exactly what just came up in the chat too, that oftentimes too, those things aren't mutually exclusive, and you can feel like you're in a girl's body and be attracted to girls. And so it's not necessarily one or the other. And so it really does take more exploration, I think, into helping the person feel out what is right for them.
Mm-hmm.
What is a good way to address handling urges that are starting due to puberty with a male who is nonverbal? Yeah, so I think that it really depends on a variety of issues. And so for some folks that I see, they say, really what we are struggling with is just knowing like how to explain that my body is changing. And so some ways that I've done that with people before is thinking about pictures of family members. Like if you have a grandparent and there are pictures of them as a baby, you can talk about how, this is what they look like as a baby, and this is how their body has changed over time. And you can also talk about other people's bodies changing over time too. And so you can do social stories or other visuals to kind of show that you might get arms under your armpits, your voice might deepen, or you can talk about other changes that will come along too. And there are some books that are geared towards younger kids that have some good drawings and depictions that can be useful. I recommend that parents preview all materials before they kind of think about what's a good fit for their child. And so one way that I found that's really helpful during COVID is you can YouTube child book titles. And oftentimes there's people that read those things on YouTube, and you can listen to the book before you make the decision to purchase it or try to get it from a library.
Well, thank you all so much for coming. We are almost out of time. It looks like we have one question. So if you can stay, great. Lindsay and I are happy to hang out a little bit longer. Julie is saying, how do we differentiate between questioning gender identity versus emulating friends questioning gender identity? Yeah, that's a great question. I think I think it's not a problem if, kids are emulating their friends and are curious about their gender identity because their friends are curious about their gender identity and are exploring that. And I think, it's important for all people to really consider, we live in this binary world and we're just kind of told, like, if you're a girl, this is who you are. If you're a boy, this is who you are. And it's really not like that. And so I think exploration can be very healthy, regardless of why it's happening, if it's from friends or, self-directed. And thank you all so much for sharing these resources. We love learning about new resources.
Mm-hmm.
And so we appreciate your time so much. Thank you.
Oh, thinking about, cultural or religious norms. Yeah, this is one of those pieces where we think about intersecting identities, right? And it can be really tricky. And I think that this comes up a lot when we're thinking about gender and sexual orientation, most commonly, as well as some of these challenging behaviors. Like I hear this come up a lot around masturbation. And I think that it's important to do some exploration with the family and thinking about what their eventual goal is and why they're coming to see you, and try to help navigate those waters in a way that fits for them, but is also supportive and helpful for the child. And so it's a really challenging it's really challenging to do that. And it's easier said than done. And I think Caitlin and I could probably give a whole nother presentation on that piece.
I think we do have to follow a family's lead a little bit in terms of where, what their values are, and trying to understand that and supporting them and starting slow. That this can be really overwhelming for parents who come from different backgrounds where, they've never talked about this before or considered these things before. And now their child is really bringing this to the forefront. And so I think starting really slow and working up from there.
And I also, we haven't talked about this, but I also want to acknowledge that I really appreciate people kind of talking about what we know about the terminology and the language that is being used when we talk about this stuff. And Caitlin and I are certainly learning alongside each other as well as you guys are today. And so thank you for pointing out if there is better terminology to use or things that we should be considering as well, because we certainly want to make these conversations accessible and current, and make sure that we're using the best terminology to honor people's identities also.
I see one other thing coming through talking about kind of the process. I'm not sure what you're referring to, what your son is going through. I'm thinking it's probably something with sexuality or gender identity. And that, yes, I mean, that it's a normal part of exploration for adolescents in general. But we are seeing research supporting that kids on the spectrum are identifying as LGBTQ at higher rates, are having higher rates of gender variance. So I do think it is a normal process. It's hard when there's additional stress or challenging behaviors or, difficulties, mental health and otherwise. That does add a more complex layer.
Yeah, I think it can be I think it can be hard in thinking about cultural and religious norms as a parent, and that's an excellent question, Jamie. I've worked with several parents that will see pastoral counselors or religious leaders to provide some support in navigating their own religious and cultural experiences when they're thinking about this stuff for their children. I've also seen parents work with somebody on an outpatient basis in individual therapy to think about just identity and how these pieces fit together when they're thinking about religion. And it's really tough to kind of think about how to marry all of these things, because oftentimes your own religious or cultural beliefs may differ or be inconsistent from your child's or your partner's or the community that you live in or your extended family. And so it can be hard to know how to bridge what gaps might exist and how to find a common ground to support your kid to the best of your ability, given what we know about all of these things. And I think there's a good point being brought up in the chat too about, really just trying to do your best. And it's hard to watch your kids struggle. We didn't get time to talk about this today, but another thing that I think is challenging that I've had conversations with parents around is this idea that when you get an autism diagnosis, there's a grieving process oftentimes because you may have ideas around how your child is going to progress through their life, and that diagnosis might shift what your original thoughts were. And for some parents, hearing that their child is LGBTQ brings up similar feelings of grief and thinking, I really don't want my kid to have another hard thing that they have to struggle with. And it's tough to know how to best support them in those ways. But it's great that I think it says something that people are here and showing interest, and there's more and more coming out around these topics in thinking about how to support families and support kids and figuring all of this stuff out.
Thank you all again for your time, and we wish you well and have a good rest of your week. Take care.
Thank you.